Finally, someone reaching out to us through the gram. This question comes from a Natalie, and she wants to know, hi, doctor. My mother and my aunt both went on hormone replacement therapy. My aunt had some complications and died a few years later of breast cancer, but my mom never had a problem. I want to know what the risks and benefits are of hormone replacement therapy, HRT. This is a really good question. Who wants to take it first?
So that's a great question, Natalie. And every great question does deserve a great answer. So I would say that the benefits and risk of taking HRT really depends on your age and your menopause symptoms and any risk factors that you have. So if you're under the age of 60 and have menopausal symptoms and you're not at risk for like breast cancer or blood clots, the benefits of HRT are likely to outweigh the risk. And so the main benefits of HRT is that it does relieve most of the premenopause and menopause symptoms, such as mentioned in the video, like hot flashes, night sweat, sleeping, vaginal dryness. Those are all great. But it also helps prevent osteoporosis by increasing your level of estrogen, which is really in need for healthy bone. But the most important thing is to talk to your provider to see if he can help you decide if HRT is right for you.
And the next question comes to us from Matilda, who reached out through YouTube. She asked, Dr. Camejo, I'm a postmenopausal woman and I want to know how I can reduce my risk of developing osteoporosis. I'm not postmenopausal yet, Dr. Camejo, but I love the 411 and osteoporosis. What can you tell us?
So Matilda, that's a good question. But before I give you and Kathy the 411 on osteoporosis, let's check out a video from our good folks at the Mayo Clinic.
Osteoporosis is often called soft bones.
Osteoporosis is thinning of the bone to the point where the bones can break.
Dr. Bart Clark, a Mayo Clinic endocrinologist, says common breaks from thinning bones occur in the spine, wrist, shoulder, and hip.
Women in general past menopause, past the mid-50s, are at high risk for this because of the degree of bone loss they have due to the lack of estrogen.
The standard screening procedure for osteoporosis is a bone density test. Treatment is a combination of medication, adequate calcium and vitamin D intake, and physical activity.
So the perception is sometimes we can't fix it if it's a problem. It's just the opposite these days.
Dr. Clark says if you have osteoporosis, you need to be careful not to overexert your body, which can lead to fractures. But in general, simply walking for 30 minutes, 3 to 4 days a week is the right amount of physical activity. For the Mayo Clinic News Network, I'm Jason Howland.
So osteoporosis is more common in women than men, but men do get it. So you have to look at that as well. But the primary risk factors for osteo is advancing age. But there are a few risks that also increase the likelihood of that. And race is one of them. So white and Asian women are more at risk for osteo. Body size, so people with small frames, family history of osteoporosis, hormones that are low levels of estrogen or testosterone, and certain medications like long-term use of antidepressants can also lead to osteo. And also look at your lifestyle factors like excessive alcohol drinking or low levels of physical activity and smoking can also lead to osteo. But take steps to limit some of these risks, but there are other things you can do to maintain bone strength and prevent osteo. One thing for women, definitely take calcium and supplements. Women over 50 need at least 1,200 milligrams a day. Exercise regularly so that it impacts bone strength, and muscle strengthening is one of your best defenses. Add more lean proteins to your diet. More protein intake creates higher bone density for you. Remember to get enough vitamin D. That's always great, which a lot of sun, but limit your alcohol consumption because it does affect the balance of calcium in your body, and it impairs your body's ability to actually produce vitamin D when you're exposed to too much sunlight. So heavy drinking can create hormone deficiencies. And maintain a healthy weight. So people overweight also have an increase. And if you smoke, quit, because studies have found a direct correlation between tobacco use and osteo.
Fantastic information, Dr. Camejo. Now let's see what we got here. This is a great question for parents, especially. This one came from Facebook, from Nala. And she asks, hey, doctors, it's almost time for me to have the conversation with my young daughter. I'm obviously talking about sex and birth control. My husband had a vasectomy, so it's been a while since I've given much thought to protection. Can you tell me about the different types of birth control and their effectiveness? But seriously, doctor, what should men, I have to say men and women, know about birth control these days?
So Nala, I appreciate the outreach, and I'm happy to hear you're going to have that important conversation with your daughter. I remember having those conversations long ago. So I'm going to let Marissa practice and answer this one.
So there are many different forms of birth control to consider. One of the most common forms is the birth control pill. There are two types, one that has a combination of both estrogen and progestin, and the other one is progestin only. Fun fact, recently the FDA approved the first over-the-counter birth control pill. It's called the O pill, which does not require a prescription. With perfect use, birth control pills are typically about 99% effective. The most effective non-pill birth control options are going to be long-acting contraceptives. So this includes implants, which are placed into the arm, or the intrauterine device, also known as the IUD. And these are over 99% effective, and they can be used for many years at a time. For those who aren't afraid of needles, there is a contraceptive injection, and these provide birth control for several weeks, and they have about a 94% effectiveness rate. There are also vaginal rings, which last several weeks, and weekly birth control patches, which could be considered. These are about 91% effective. And another common option are single-use condoms, which can also be used to protect from STDs or sexually transmitted diseases. And when these are used perfectly every single time, condoms can be about 98% effective. So as you can see, there are many different options to consider for birth control, depending on the effectiveness, to how long you have to take each of these, how long they last, how invasive they can be. I always recommend talking about these options with your doctor to get the most information and to understand what would work best for you.